Hey, what's going on, guys? Welcome back to the Jeremy Scott Fitness Podcast Radio Show, coming to you on this Sunday, September the 22nd, 2024. Hopefully it finds you staying safe and staying sweaty all at the same time. On today's episode, we are talking with Dr. Carrie Yaeger. But before we jump in and harass her real quick, couple housekeeping things. One, the Jeremy Scott Fitness app is live. A lot of you savages are in there. JeremyScottFitness.app. You guys get a week for free. If not, the next thing on the docket for you guys, we have our 12-week, what are we calling it? Total body transformation. Literally, it is the best of BJ Gaddour's stuff sprinkled in with what we do here in our philosophy and training. It'll be a premium option in the app for you guys. You can pick it up in there. It's the longest program we've ever done, and it'll probably be the longest program we ever do. So if you guys are serious about kind of heading into 2025, being in the best shape possible, this would be the program for you. The link will be in the show notes. If you guys got questions, hit me up. Otherwise, JeremyScottFitness.app. You guys get the week for free. Click the upper icon, and you guys can join that 12-week when we kick off, I believe, September the 30th. And you guys already know, real quick shout out to my friends at AG1, the one thing I take every single day and I never miss. If you are somebody who does not eat enough fruits and vegetables, and admittedly, that is myself, trying to eat 10 to 12 servings a day seems like a pain in the ass, especially when I travel, which I've been on the road a lot lately. This is the one thing I take. I grab a sample pack, throw it in some water, shake it, slam it, and I'm good to go. If you guys don't want to travel with 14 different pills and you're looking to kind of cover the gaps in your nutrition, you still have to eat real food. This would be the one thing I would take every single day. So hit us up if you want a free sample pack. Monica will send some to you right to your front door. I don't care what state, country, province you live in. We'll get you some. But if you guys want to pick some up today, drinkag1.com/Jeremy Scott, and we'll throw in a year's supply of free vitamin D3 and K2 and 5 free travel packs with order number 1. Always a mouthful. Carrie Yaeger, welcome to the podcast.
Thank you.
Okay, so we'll just have you do the title, they'll get it. But if you want to go kind of origin story, I don't care how far back you want to go. Did you play sports as a kid, where you went to college, all that stuff, and then we can just jump right in.
All right. My name's Carrie. I am originally from Las Vegas, Nevada. I played competitive tennis my whole life, and then went to college at Gonzaga University and played on the tennis team there, and that was kind of how I got into physical therapy in a way. I knew I wanted to do something medical, but I was really fascinated with how the body worked together, muscles, joints, bones, and I think I was the typical, athlete, so wanted to go into PT, thinking I'm going to work with athletes and that type of thing. So went to Gonzaga, graduated, went to Regis University for PT school, graduated in 2011. So I've been a PT now for about 13 years. First 3 years or so, I just kind of dabbled in everything I could, trying to figure out what I liked to treat. Just really wanted to kind of hone in on my orthopedic skills. I treated everything from pediatrics to breast cancer rehab to vertigo to just general ortho. And then about 3 years in, I took a pelvic floor rehab course, and it just kind of opened my eyes personally, professionally, made me realize I wasn't treating a lot of my patients as effectively as I probably could be. So I just decided to keep taking courses. Around that same time, I was working in Phoenix here, but I moved back to Denver, where I went to school, and started working for a sports medicine company. And we saw a lot of post-op hips, labral repairs, hip arthroscopies. So it's just seeing the huge connection between the pelvic floor and the hip, and that's kind of my passion and what I would like to treat the most. So did that for a couple years, and then I moved solely into pelvic floor rehab. So treated men, women in Boulder, Colorado, and then in 2016 came back to Phoenix, and so I've been here ever since, and just kind of built up my pelvic clientele from there, and that's kind of what I've been doing. I work for Spooner Physical Therapy, and I was kind of directing a clinic / seeing patients part-time. Now I'm kind of in an administrative role, but I'm still a huge advocate for pelvic rehab and just kind of our pelvic health team. And I still like to treat some patients here and there, just kind of some direct referrals, and still keep my hand in it. But
So I'll go back. How did you like Spokane?
Oh, loved it.
Yeah.
Spoke-Compton or
Yeah. I was going to say that too, because my wife went to Washington State.
oh yeah,
And so we have,
spent a lot of time in Pullman.
yeah, a lot of cougs who like live here, and our friend Matt does, and he's like spoke Compton because he told a story like his Honda Civic got stolen
Yeah.
like 5 times. Is that
Yeah.
like a common thing? It's
Yeah.
weird because Gonzaga is like such a nice,
Oh yeah, the
expensive
campus.
school.
Well, the campus is awesome, but it's like right in the heart of Spokane, kind of meth neighborhoods.
no shit.
Because northern Idaho, northern or like eastern Washington is kind of known for meth and
Really?
but yeah,
I never
it's
knew that.
cold. It's it gets dark. So
Yeah.
and Gonzaga was near some of those neighborhoods. So.
Interesting. Kind of like Grand Canyon here,
Yeah,
where the school's super nice.
Yeah.
But like we did an adoptive family like 2 blocks down the street, and I'm like, it was a little dicey.
Yeah,
Interesting.
yeah. So if you are from Spokane, you are a Spokey.
That's what it is. Huh?
Spoke-Compton, Spokanistan, I think we call it.
No shit.
Which is probably not appropriate, but
It's all fun. Yeah.
but it was awesome. It was the best experience of my life. So
Nice.
I loved it up there.
So like you do this pelvic floor like certification, you go through the program, and you're just like, this is just an area that a lot of people need help in, or when I'm looking at people, I'm not like, how does that draw you specifically? Because it's, again, I guess the question is, there's not that many pelvic floor PTs, at least that I've been aware of.
No, there's more and more now. When I was in school, there was really not a lot of therapists. I had a professor through my school who did it, but even when I was in school, I was like, I don't think that's really what I want to get into. So I didn't even take the elective. But when I started taking classes, I think you traditionally think pelvic floors for older women who are leaking because of hormones, menopause, that type of thing, or just typically postpartum. But it's so many more people, young, old, kids even, sadly. So there's just like you can help such a wide array of people. Most people probably could benefit from pelvic floor rehab at some point. I mean, you think of fitness and just like, how do you appropriately lift and your breathing mechanics and your body mechanics? I mean, it's a canister system. So if you're working on your core, you're working on the top of that canister, like, are you considering the bottom of that canister, which is the pelvic floor? So I think people just tend to not want to think about it because it's such a taboo word and phrase, but really it's a major part of our body, that it's a pressure system. So we need to be using it effectively. So from the fitness side of things, it's important for everybody, old, young, whoever. And so I think the more I went through it, it was really just eye-opening how many people truly could benefit from that type of therapy, and just how it was not being served in the medical community. And even physicians don't really know what it does and the importance of that. So that's kind of why I've been trying to be an advocate of it for the last 10 or so years.
And that's what it is, like, probably the last decade it's kind of come on as...
Yeah, it's definitely a hot topic now. I mean, especially like 4th trimester, postpartum, just women's health in general. So it's definitely becoming more well known to the medical community, and just with social media and everything, information's getting out there. There's just still not enough practitioners for the people that need it.
No, because I guess that's the thing. I'll get to that question in a second. So the biggest misconceptions are it's just for old ladies who do jumping jacks and feel like they're going to pee their pants. Mm-hmm. And that's obviously not the case, because you see kids, which seems odd to me. Mm-hmm. Like, I wouldn't think kids would even be...
Kids tends to be like incontinence, wetting the bed.
Yeah.
It's a lot of due to like constipation as a kid. So you think about diet and you think about just kind of where our society's at. And then, more recently, just mental health. So anxiety and just kind of lifestyle, like what's your house like kind of thing.
Yeah. A
lot of kids that I've dabbled in it a little bit. It's definitely not my skill set and expertise whatsoever, but sometimes, kids with sensory processing issues, or a lot of diet related, which can then go along the sensory aspect there, but or maybe they had bedwetting issues as a baby, young toddler, kind of into kids phase, but that's typically what you'll see kids for.
And like the way you talk about it though too, and you and I have talked before multiple times about this, like you kind of look at it as like, I'm gonna try to say this the nicest way. There's so many so many physicians I've met, worked with, some are great, some whatever. And that's any industry, teachers, pilots, fitness people, got it, we know. But you kind of look at it as like, what are all the areas you can look at? And I think a lot of people don't do that. And so like when you do like an assessment or something, if you can give like a basic example, like, and I know it's going to be different, kind of for every person, but what does kind of an assessment look like when someone comes in or they get referred probably?
Yeah. I think typically you think, okay, if they're coming in for pelvic floor rehab, I only have to look at their pelvic floor. I only have to look at I can't tell you the people that I've seen that have seen other pelvic floor therapists, but all they've looked at is the pelvic floor. They haven't even looked at the hip. So it's like, if you're not considering everything around it, like you're really doing a disservice to the patient, but you have to look at the whole picture. So, how did it all start? But from a assessment standpoint, I'm looking at everything from neck rotation to how their foot is moving, because if they're not loading properly through their foot, how are those forces going to be coming up into the pelvis and the hip and the pelvic floor ultimately? Trunk movement, strength, like breathing. So I'm looking at the body as a whole. You can't just pigeonhole and just look at the pelvic floor.
But you think like there's a decent amount of PT people that are overworked that just, it's what they do, or they're just been doing it for 1,000 years and they're like, fuck it.
Yeah, and I will say some of the traditional pelvic floor education is very passive, not very active, movement functional based. So that's kind of my soapbox, is you have to involve that in order for someone to truly get better.
So like when we can say anything on here. So like, Sean doesn't give a shit. Sean's filming everybody. Like, what does that look like when someone comes in? Like, you have to manually, assess them.
Yep.
And
in order to get a true depiction of what's going on in those muscles, you can do some external palpation and superficial palpation, but in order to truly understand the coordination, the muscle tone, the strength, endurance, how it's, interacting with the rest of the body, you do need to do an internal assessment. Which I think that's what some people claiming they will do pelvic floor rehab sometimes and don't include that are kind of doing a disservice to people.
Yeah. I get it. Doesn't sound...
No, it's not
it's
like
not
that's
it's
what
not
I look
not a fun
forward
part of the
to
journey,
every
no.
time, but...
But it's necessary.
Yeah.
And
it's just another part of the body.
So when you get people, and again, I guess the most common things like fitness people, like whether you could be not strong enough, or you could be essentially too tight. Mm-hmm. And both can cause...
Yeah, you can be strong and you can be, a very high level athlete, fitness person, but if your muscles are not working as efficiently as they can be, you can be having some dysfunction. And we see that a lot in higher level athletes, is just their coordination is off, or, where are they tight? Where are they holding tension? And that can be from life related things or just movement inefficiencies.
Or a combination of...
Yeah,
all of them.
Absolutely.
So when you see, I guess, women come in, what's the most common issues off the top, when a female would come in?
I think still the most common diagnosis we'll see is postpartum weakness, prolapse, incontinence, postmenopausal weakness, leakage, that type of thing. But there's a huge population. Pain is significantly going up with a lot of the kind of endocrine disorders, autoimmune disorders with EDS and, endometriosis, and a lot of people that are having fertility issues and that type of thing. So probably the leakage, incontinence, that was a lower part of my population. And luckily, I think the postpartum population is getting better just because of the advocacy and information out there, and people are being advocates for themselves and seeking it out before waiting for their doctors to bring it up. But I saw a lot of just chronic pain over the years and, tension related issues, or just chronic related pelvic issues that you wouldn't normally think of. Or, my favorite is chronic hip pain that they've gone to, or back pain that they've gone to see therapists and doctors and gotten injections and MRIs and all sorts of things, and they still can't figure it out, but no one's really thought of the pelvic floor before. So
That on top of, and like the hormone stuff, where if your hormones are off, which sounds
Yeah.
strange to say,
Yeah.
where essentially you can, we've had a lot of females on these podcasts too, where they're like, yeah, essentially I feel like I have like a UTI every day, but
Yep.
they don't
Yep.
have a UTI. And
So,
it's
yeah,
hormonal.
Yeah, women and men. I mean, you hear like, yeah, I just feel like I've been to the doctor and they've checked me for a UTI, and then they put me on antibiotics, and maybe it helps for a couple days, and then the symptoms come right back, and so they just keep going on these spirals. But no one's really ever thought to think of like, what's the muscular skeletal system doing, and how is that contributing to a lot of these people's symptoms? So I think the difficulty with pelvic floor dysfunction is the symptoms sometimes don't present as a musculoskeletal pain or dysfunction. It presents like an infection, or it presents like some disease process going on. And so that's why you go through the whole gamut of these imaging and blood work and urine testing, like things like that don't come up positive. And so it just starts this spiral of people thinking they're crazy. Like I have all this pain and these symptoms, but nothing's showing up on a test. Like, what's wrong with me? And you look at the musculoskeletal system and, sometimes things pop up or you figure it out. But I think you also had, like you had kind of said with hormones, you have to look at the whole picture of the person, like what's going on in their life. Like a lot of times I'll ask people, like, tell me about the last 12 months of your life. Like, what major life events have changed? I saw a lot of people during COVID, especially young males, coming in with pelvic floor pain or urinary symptoms or bowel related changes. And it was a lot of anxiety because of not knowing what was going to happen in the world and with their jobs and that type of thing. And it was affecting young males, I think, more than a lot of people. So you just never know what's going on in someone's life, and you have to ask further questions because that's how it's going to manifest in someone's body.
And you do that, but I don't think a lot of general, and again, I'm not knocking like a general practitioner,
No.
but some of these guys see 20 to 25 people a day. Mm-hmm. And these are different people every day.
Yeah, they're not set up for success, just in how our traditional medical model is set up. So it's to not their fault. It's just kind of how the system is set up to be. And so, there's no time. And every once in a while you find some few people that think to ask the further questions. And I also think too, the way that the, physicians are trained is just a very like black and white research-based flow chart. If you fall in this kind of piece of the flow chart, then there's a solution. But if you don't, then it's like, I don't really know, let's move on to the next person kind of thing, which is sad. And I think sometimes you can just get so much information from just talking to the person.
But it's like if you only have 20 minutes and it's like your one shot, we call it like diagnose and adios.
Yeah.
You kind of just get them out of there. And you're not that they're not like helping you, I guess, in quotations, but it's a Band-Aid on a gunshot wound. We're just going to try to make you mask the symptoms, yet we can't figure out the root cause of the problem. I guess my question would be, like, I met you through other physicians that we know. I go, but I have an insane network of people. And even for me, I have to do, again, I'm a fucking dummy in a warehouse and I have to like be my own advocate. And so take all these pieces. Most people don't have that. Do you find like some maybe general practitioners don't even like understand what you do or know what you do?
Oh, absolutely.
So they wouldn't even think to like offer you as a resource if they even knew who you were.
Yep.
Which is crazy.
So that's what us as PTs, especially pelvic PTs, we're trying to do more education to physician groups there's so many opportunities of how you can help people pre-op, post-op. And you see this in the orthopedic realm too, where they just don't think it's necessary, but it's not like we're just trying to do PT just to do PT. It's like you can only help someone, so why not let them experience it or, utilize that service. So I don't know where I was going with this, but
like, do you create relationships with like certain physicians and then that's how the people come in?
Yep.
The ones who
it's
believe.
a little bit of community events, word of mouth. I think that's the biggest piece of it now is word of mouth and people being advocates for themselves. But yes, over the years, I've created a lot of relationships with providers in the area. And I would say it's a little bit easier to connect and network and this realm of therapy just because it's not as competitive, sadly.
Well, yeah, and that was going to ask you too. There's not many pelvic floor PTs that I see, but there's even fewer that work with dudes. Mm-hmm. And why is that? Just the nature of the game? I mean, I guess it's...
Yeah,
I mean, I
think
get
it's
it,
like
but...
a fear kind of, not fear, but just discomfort level. And, I've been burned a couple times by a couple creepy men out there, but,
No shit.
oh yeah.
What do you mean? Like they're just like, you don't have to share the stories.
Just in a way, asking you to do certain things that,
Oh, bro, yeah.
yeah.
Oh, I didn't even think of that.
Yeah. But I mean,
Oh, it's the Wild West out here.
yeah. Oh yeah.
Oh yeah, dude. I guess it's like it's anything where you're with
Sure,
people. Like
sure.
when you say that, like we call everybody here dude.
Mm-hmm.
Like when you come in, I'm like, "What's up, dude?" And there's a lady, she's relatively new, and she's like, "I love how you call everybody dude." I'm like, "Well," she's a 45-year-old woman. I'm like, "I don't do it like because I'm so stupid." I go, "We do it so everybody knows. For the last 15 years, that's all I've ever said. So,
Yeah.
so it can't be like, well, Jeremy called me like honey or did some
Yeah,
creepy
yeah.
weird shit."
Yeah.
I go, "We try to keep it very
Yeah.
vanilla, and like I don't touch anybody here." Unless like they ask a specific question, and even then we try to like verbally instruct. And not that I'm against it because I'm a fan of correcting. I go, but
You have to be careful.
yeah, dude.
Especially nowadays.
And people take it a certain way too. And I can imagine what you do because it is very, what's the term?
Intimate.
Yeah,
I mean, it's
it is.
vulnerable.
Yeah.
I mean, that's, yeah.
Because if you go get like we'll go to like movement restoration for massage, and it's usually the same people you see. And I'm like, you're essentially wearing boxer shorts in there, and they're touching all your shit, but you're like right in the junk, dude.
Yeah, and I think too, because of what people are coming in for, I've seen a lot of people that have been abused in their lives and have experienced significant trauma. And so I've had people that will kind of like have out of body experiences and just kind of check out for a little bit because they're experiencing past things that they've dealt with. And
Oh shit.
oh yeah, so I've kind of treated the whole gamut of pelvic floor, and so that's challenging, and it's people experience a lot of emotional changes and symptoms while you're in treatment sometimes too, so you have to consider that and just kind of know what to do and take a step back and let the person process through it. But
Because you're kind of like, when they come to you, depending on where they're at on their journey, I'm assuming 99% of the people you see, it's not their first stop.
Yeah.
Like, it's like when something doesn't feel good, it's not like, man, got to call the pelvic floor PT. That's my first go-to.
yeah, that's kind of what we're trying to get out there though, is before you go through this whole gamut of testing and needles and all sorts of stuff, go see a PT first, because we have training on, the musculoskeletal side. And then if we believe that it's truly not in that realm, like then we'll refer out. So that's what we're really trying to advocate for, is like have your PT on hand, call them, like ask them questions. What do you think I need to do, kind of thing. So, I mean, in all of PT, we're trying to get that way of like have your person on speed dial.
But it's weird because it seems like for the most part, I mean, obviously pelvic floor stuff is a little bit more, I'll use the word invasive, I guess, because you have to actually like do some manual stuff. I go, but even with that versus all the other things you could do, it's the one you can just come back from. Well, what I mean is it's not all these tests that are, again, if that's your issue, male or female, the tests you're doing are not all external. So there's things going into your body and you're doing a multitude of tests, which is, that journey is not pleasant. And then, but what you guys do, it's just you're in, you're out. There's some actually like, here's your, things we can try, your prescribed exercises, here's a routine. What I'm getting at is like, you guys will actually have some behavior modification where a normal, and that I think that's the problem with most medicine, is like you almost need, like you go see your physician, but then you have someone who does behavior modification on top of it because they don't have the fucking time or they don't have the education. I don't know which one it is to give that to you, where you guys will like at least do that. And when you think about like what we do in terms like even like on the fat loss journey for people, like people will go in, there's this book, Think Like a Freak. And they give all these examples of like what you could do versus what we do. And it's, when I say it, it'll sound crazy, but when you strip it down, it's not. It's like someone will go get like gastric bypass or do like lap band stuff, which is pretty fucking intense. Yet you could like puke in a jar and wear it around your neck, and every time you were hungry, you could smell it, and then you wouldn't be hungry. That sounds fucking insane, and it is. I go, but it is way less invasive than this thing. And what you guys do is actually like it's an actual thing backed by science, like it does help people, yet it's not typically the first place we think to go because we're like, well, but let us go to our normal doctor. And that's where I think if you don't have, and I'm not bagging on anybody's doctor, like do what you got to do. But if they're telling you certain things and it's only kind of a narrow path, just know, hey, you have to be your own advocate. But there's other areas you can go check out if you're not getting the outcomes you want.
Yep, absolutely. You know yourself the best. Like you know what feels normal and what feels off. And so if you're not getting the right information or if you just don't feel like you're getting your questions answered, there are other resources out there for sure. We do a ton of lifestyle education, which is hard for people to hear because they don't want to put in the time. And I know you've experienced that with a ton of people that you've worked with.
Oh, yeah.
But a lot of what I'm doing is diet education and sleep education and just for basic bladder symptoms. You can be amazed at what changes you can make by doing a few stretches and watching what you eat and drink and your sleep habits to instead of just going to take a pill.
Well, and I think with, again, we've talked about prescription medications on here ad nauseum, but you can get down that rabbit hole and it's like now I have this belief that I have to take this medication essentially forever. And if you adopt that belief and hold it long enough and you're listening to this advice, you can convince yourself, your mind is super powerful. Mm-hmm. So you can convince yourself of a lot of fucking things. So you can think like Santa Claus is real, or you can think you have a fucking disease. Like you literally can, like, or if you believe in Bigfoot, whatever your thing is, like you can have this belief. I go, and some of those things aren't harmful, but when you believe you're sick and you do it long enough, it's hard to get out of that, especially when you're dependent on this drug. Now, when in reality, you could have maybe done 3 or 4 other things to actually fix the problem and not mask it. And I know that is a tough thing for people to get to. And I know because most doctors in general, like you look at it, if you do pull your blood work, they'll say, well, you're in range. Mm-hmm. And I have an issue with the ranges on a lot of things because what is in range and what is optimal are 2 different things. And why would I like walk around, like if I couldn't fucking see 20/20, well, your eyes are like in a decent range. Yeah. I'm like, well, put your fucking contacts in, dude, and help you see. Like that's how I think of hormones. And we don't tie hormones to like how you take a piss, how much energy you have, how you sleep, how your brain works. I go, but they're all very much connected. Mm-hmm. And I think a lot of times like we'll prescribe and we'll set you on our way when someone like you kind of looks at it as the whole scope. Mm-hmm. Hey, how are your hormones? How are you eating? How are you sleeping? How are you training? Like is an actual, and you're one of the people who will be like, well, if I can help you, I can help you. But if your issue isn't this, like you should do something else. And I hate to say this, but a lot of times like whoever you're going to just puts you on a path and they kind of set it and forget it, which is not a good place to be in medicine. Mm-hmm. So when I look at it, what's a percentage of people you would see like men versus women? Like way more women than dudes, probably.
Yeah, there were times where because I was one of the only ones in the valley that was treating men,
you would get a good number.
Oh yeah, it was a big chunk of my caseload. Probably close to half at times.
No shit.
Yeah.
But you think like are dudes less reluctant to come in than women, or about the same? Or
I guess sometimes, yeah.
Yeah.
Definitely. I mean, it takes a little bit more convincing for sure.
Because we're stubborn and stupid.
Well, it's just not something you typically think about. You typically think of women who have had children, and you typically think of women who have gone through menopause, and that's why they're leaking. It's just men have never been put in that kind of category, and so it just takes a little bit of education. And that's what I love is just the education part of like, you have these muscles too. Like there's no reason why this couldn't affect you. And a lot of what I see is like tension related pain because we all hold tension in our bodies somewhere and we all have life things going on. And so a lot of what I do is just make people aware of their bodies. What are they even feeling in their body? Where are they holding tension? A lot of people hold tension in their hips and pelvis. So that affects those muscles in the area and can create back pain, hip pain, abdominal pain, digestive changes, bowel and bladder dysfunction, sexual dysfunction. It's a huge thing. And we just don't think of it being caused by a muscle issue.
Just like how people sit at their desk and do let's crouch our shoulders up, my traps, my rhomboids are tight, my neck hurts. Essentially, you're saying it's the same thing.
Yeah, I mean, but that in itself, posture can affect your pelvic floor too. We only think it affects our neck, but it changes the way your body mechanics are and can create breathing patterns and muscle holding patterns and way we sit and nerve compression, and that it can do all sorts of things.
It's almost like it's all connected.
Yeah, right. Weird.
Yeah.
I mean, I love treating the foot with pelvic patients.
No shit.
Yeah, it's one of my favorite things to look at.
Like, what do you like in terms of how the
ankle dorsiflexion, the way you're loading through your great toe, like because of how it changes forces up through the rest of your body.
And just that constant repetitive over again, it articulated a change up the chain, and now here you are. So like if you're like a dude and you're listening and like you have issues, like maybe it's something you check out versus just like, hey, I went to the doctor, they gave me some pills and they said, hey, good luck to you. This is how it works. But it could be, I guess what I'm saying is like, what does it hurt to fucking go?
Yeah. I mean, is it the most comfortable thing? No, but I try not to make it that uncomfortable. And it's an hour out of your time. And then maybe we never have to do that assessment again, but I can give you a lot of different things to try and resources and that type of thing.
And if it could be a solution for people versus like an actual, we call them like a fix or like an outcome. Because if you think about like in America, we prescribe the most fucking drugs, yet I believe we have the worst like outcomes. Which again, I'm not against drugs. Like they work.
No, there's a time and place for everything.
And they save lives. And like if I'm sick and I need a Z-Pack, I'm like, super cool, dude. Like I'll do what I have to do. I go, but so many times like we're taking these things and yet they're not giving us the outcome we want. And there is other routes. But a lot of times we don't look at, I guess the average person's never been taught like.
Because it takes time.
For sure.
That's the thing.
But even like, I guess, and I understand that, I go, but when you take the drugs, it's not like they really, if it's not really your issue, it's not like they really work. Like they kind of mask what's going on, but they don't actually help the thing.
Yeah, men with chronic prostatitis is probably one of the biggest things I see in males. And
which explain for these.
It's just assumed that the older you get, your prostate is enlarging a little bit. But the symptoms present kind of like a prostate infection. And so most men that I see with this will come in and they, come in with a diagnosis of chronic prostatitis, and they've been on rounds and rounds of antibiotics.
For months.
For months. And nothing. Change. And now you're dealing with all these gut issues and all these other things that are going to even more impact your pelvic floor. But no one has looked at the muscles yet. And yeah, your prostate may be getting a little bit bigger. Yes, that's a normal life change, but it doesn't mean you have to live with bladder inefficiencies and, poor urination, poor sexual function, that type of thing.
And you probably don't go from 0 to 100.
No.
And I think that sometimes that will.
Well, and if it comes out of nowhere, like your prostate's probably getting a little bit bigger very gradually over the years. But if you just all of a sudden have like all this pain and dysfunction, it's probably not because of that. It doesn't just happen overnight. So, something else is going on there, whether it be, something going on in your life, a change in medication, a change in lifestyle, a job change, whatever is causing these symptoms that are mimicking a prostate infection.
And so for some people, like it's just, they go to a physician, then they find a urologist, and it's just essentially, it's like when you go to a surgeon. Cutter's cut, dude. Like that's what they do. I'm not saying it's right or wrong, but they know what they know. And so they look at things sometimes, and I'm not saying all, there's great ones and there's average ones. But if they're looking at it through, I guess if all you have is a hammer, everything's a nail. Because they're looking at it from this lens. It's like, well, I've seen 47-year-old you before. This is what you have. This is what I do. And just this is how it's going to be. But that's not, I guess, the misdiagnosis that happens.
Yeah, my issue with the traditional medical model is like we just put people into buckets of like, okay, well, you're this age, you have these symptoms, this is what it should be. And you just have to live with it because that's what makes the most sense. So we're taught to believe that we just have to live with it, whether you're a male or female or, females that have kids. It's just this unwritten rule of like, oh yeah, well, you're supposed to leak your pants when you jump on a trampoline or run or whatever. And it shouldn't be that way. And I think with the traditional medical model, it's like we kind of try and put everybody in these buckets, but we're not really looking at everybody individually. There's so many variables and factors that can contribute to someone's pain and dysfunction.
And so, like, when you see, like, females, like, who have, whether it's, I guess if they've had kids, right? Obviously a dude, never experienced it. It seems traumatic is the word I use. Like to have a human, like, I don't really like taking a big shit. So I can't imagine like having a kid come out of your body.
Yeah.
And like
and then you're just expected to get right back to normal within a few weeks.
Yeah. But that's not reality for most people.
No.
Like when you see those guys, like, do you have a protocol like that you take them through? Like for people, like they come to you.
I don't like to say protocol because I just feel like everybody is individual in what they need to do and what's going on. I mean, myself personally, it wasn't I've been treating this for 10 years, but I just had my first kid 3 years ago. And even just what I knew versus then experiencing it was a whole new
different.
Yeah. It, like opened my eyes to so many different things. So every patient that comes in, like, well, if you for the postpartum example, what do you need to do? What do you want to get back to do? Like, do you have one kid? Do you have multiple kids? Like, are you working? Is it cleaning the house that you have issues with? Is it playing outside with your kids? So you have to look at each person individually. And not even that, but like, what was your life before kids? And, any other medical issues or things that they had going on or past injuries. I mean, it's baffling how you could go get a knee scope and you're just expected to go to therapy right away. But you push a baby out of your body and it's like, well, go back to the way you were and go take care of your kid now. And you don't need therapy or anything like that.
But it's now starting to,
it's getting better.
OBs are being like, hey, here's some education on it. If you have issues, I guess if someone's going to have a kid or they recently had one, like, would you just, I guess, is there people out there who just have a kid and they're like, it's fine?
Yeah, no, and I'm not saying everybody needs it, but like what I'm trying to educate the OBs is like, let people come one time just so they can get their questions answered. Because you go to your 6-week postpartum visit and they tell you, yep, you can go back to everything you were doing. So, you've got mom sitting over here. She hasn't slept in 6 weeks and she's so worried about taking care of baby, but she's like, wait a second, I used to run. I used to do all sorts of things. Like I can just go back to doing that right now. And so I just think like, some people are lucky and they don't have any issues and that's great. But even just to go in and talk to someone for an hour and ask questions and just have some perspective of what to expect and is like great. So if you just need one session, awesome. But I think it also in our medical model, we're so much like, there has to be pain. There has to be dysfunction. We're so much not a society of like preventative medicine or, so I always just tell OBs, I can find something wrong. They're weak, like whatever, send them in there for one visit. And if they need more, great. If they don't, awesome. Like I can give them some resources. And if they ever do have any issues later on, then they know where to find me. So, but the sad thing is it's still people seeking us out versus just a standard practice of like sending people to PT for a visit postpartum.
Yeah, it seems like it would be for most people just because it's an hour of your time, and even if there was no issue, just to drive down the street, and if you had
let someone listen to your problem.
Yeah, you know what I'm saying.
You don't have it doesn't have to be about baby for a little bit or
No, that makes sense to me. Like on a lot of fronts, like the physical aspect of it, obviously. Like if you want to go and I guess if you're someone who you were a savage in the gym and now every time you do jumping jacks, you piss your pants. That seems like that doesn't have to be permanent for the next, you know what I mean?
No, yeah.
Like, and that seems like that would not be enough ideal to have a problem to have for the rest of your life.
No. I mean, there's videos, YouTube, whatever, about CrossFit athletes and how it's just expected that you pee your pants with certain exercises. And it's like, doesn't have to be that way.
No, it seems like I would not want.
Why would you want
to do that?
Yeah. Like it doesn't mean you're working harder than anybody else, but
But it's good that it's becoming more talked about and people are kind of seeking it out as an option versus just like, well, you can go imagine like having a kid, right? You've had one and not doing a ton for 6 weeks. And then like, I'm going to go back. Like how deconditioned you must, depending on what your activity level was before. But if I like go on vacation, just me, I'm a dude. And again, compared to having a kid, like I've had nothing nearly as traumatic. But even if I go on vacation and train like, and just work out in the hotel gyms or visit like local places, it's not the same as being here. And I come back here and it's like, I'm dying. I couldn't imagine like having a kid, the hormonal shift in your body, and then how traumatic that is to your whole pelvic floor region. And then coming back into the gym and like, I'm going to squat today and push a sled and try to go through the same stuff at the same speed and pace. Seems impossible.
Yeah. It's not necessarily the best thing to do either. Certain people, like, yes, it may be appropriate, but it's not for everybody. And I think too, like for women with social media, you see things and you think you have to get back to that right away. And it's just not realistic for some. Maybe it is for some, but not for everybody. And that's part of the issue is like, yeah, I was sitting there on Instagram with my new babies being like, oh gosh, I'm not back to the gym yet. I'm not back to my regular routine. Like, I'm just not good enough. And when hormones are in that factor too, you go down these rabbit holes in the middle of the night while you're feeding your baby and you're just like, it messes with you. So I think there's this also societal norm of like, you need to like listen to what your body's telling you and, you know, go back appropriately into activity. And that's where we can help too, is, you know, as PTs and fitness professionals and that type of thing, is just education and helping people, guiding people back to what they want to do.
Well, especially like for what you guys do, just in general, like for general fitness, like how stiff and tight people are, like through the hips, and how that is married to essentially every movement in the body, right? Like, so we always say like, if your hips are tight, your low back is probably tight. You know what I'm saying? Like they are like, if your pelvis is off, like everything is off. And like, even if you don't have this major issue, I go for a lot of people because the hips, the groin, the adductor, or for most people here, when we take them through just a basic, essentially like frog stretch, whether it be internal rotation or not, like it is, you see the people who are hypermobile, sure, but you see people who they can barely move. And it's like, oh, your shit is super tight and super stiff. And if you're running into those issues and then you have other things that are connected to it, it's like that can just be muscular related.
Oh, yeah.
But a lot of times people don't, that's not what they think and that's not where they look. So I guess the best part of like about PT, is it like actually, I guess for you, what is it? Like, is it the outcomes or just the people?
Problem solving, I think.
Yeah.
It's kind of like a puzzle that you're trying to figure out. That's what I've really enjoyed about the profession is it's like you're given a situation and you have to kind of figure out all the different variables and all the different possibilities, and it may change one session to the next. So that's kind of the fun part. It's challenging, but it's also fun and motivating.
But like to be in my opinion, what I would consider like what is good, you have to learn so many fucking things. You know what I'm saying? Like you can't just learn the anatomy. It's not just insertion origin points. Like you're looking at it as what I think, like, what healthcare should be. And we call traditional medicine, sadly, a lot of it is like sick care. Because most people here, and again, so I tell a story in here a lot. We used to do every fourth Friday. Essentially, we would just do like a mobility, heavy, and tissue day. And we get a group historically, which we cap them at 24. That's as much as we can kind of handle. And a lot of these people have been here for 15 years. So not that they don't need coaching, but they don't fucking listen to me anyway. So it's like, whatever. But we would do that every fourth Friday, and it would go from 24 people to like 6 people. And they would say, well, Jeremy, I don't need to do mobility. And it's like, well, dude, I'm watching you and you're older than me and I'm stiff and tight. So I know your body's like fucking wood. So now we just build it into everything we do. But that's a hard piece to get people to like commit to doing that. Like,
because I don't think you see results as much as like if you were doing strength training or that type of thing. And it's hard to see the results with flexibility, mobility training. I mean, we know it's there, but it's hard for other people to see sometimes.
Well, in terms of like, if you're lifting, right? Okay. In theory, greater range of motion, more hypertrophy, I can build more muscle. Sure. It's a long path to get there. And this is me speaking personally. Because I still lift heavy like a dummy, you know, maybe not as heavy as I used to because I'm in my 40s versus 20s, but there's a certain level of stupidity that will never go away. And I've been trying to do the front splits for like a year and a half, and I'm really, really close. But every time I deadlift, I feel like I take 10 steps back because it's just the insertion points, kind of like your glute fold, just gets tighter and tighter, at least for me anyway. But that's something I'm going to do, but it's a year and a half. to do something that will be a single Instagram picture or video one time, and then who gives a fuck? But it's more of my personal vanity just to do that, where it's hard to talk Rick into like sitting and doing a pigeon stretch, for 3 minutes aside, flowing through it. But if we know his performance is tight and his glutes are tight and he's having low back issues, if that can alleviate it, which a lot of times here, the simple fixes are what it is, I get it's a tough sell. But just like how PT is for some people.
Yeah, I think so. You have to explain like how it'll benefit them, how it'll make them get to their goals faster, how it'll prevent disease process in the future. I'm big on this from a business perspective to a therapy perspective, like explaining the why. Like if people understand it's not just there just to be there, then, hopefully they understand it a little bit more, but it's hard.
It's hard because these guys only will ask questions once the pain level is already to a level it shouldn't be. So they'll come in and say, man, like when I grip stuff, I've had tennis elbow. I've lifted forever. And they're like, man, it really hurts. What can I do? I'm like, here's the things. We have full videos on the app of this. I go, but just so you know, this is the next month for you, minimum. Like it doesn't go away in 2 days or 3 days because it took you a long time to get there. And that's, I guess, if they could do it preventative, but it's tough because you're talking, it's really an impossible task when I think about it. Like the entire body from top to bottom, front to back, you're spending an insane amount of time on tissue work, immobility work, but that's the price you pay to train. Mm-hmm. And that's where there is a disconnect in even what we do. So we build it in, but there's no way I could ever build in enough because these guys are going to go to their jobs. They have kids. So we do the best we can with what we have. And that's what I would say for most people. Mm-hmm. But usually they only come in, I only go to the doctor once I'm sick. Yeah. Like I've told the story on here. I never say names, but we've had doctors as clients who literally will go through their food logs, will look through all their stuff, and they've been a physician for 20 years. And I'll ask them, well, when at your last physical, like, what do they tell you? Like, do you have your blood work? Well, I haven't had a physical in 8 years. Yeah. These are doctors.
Physicians, we're all, healthcare people are the worst patients.
Isn't that crazy? Do you stay up on yours, though?
Like physicals or just my health and fitness? And
physicals. Like, do you go yearly or no?
Because I love, finding out that information and almost too much.
It's, and that too, like, it's a fine line you walk because it's weird when you look statistically at us as a population. We have more people like you, like me, podcasts, books, apps, you name it. I can track all this shit. I can see all my sleep, almost to the point where it's neurotic and it can drive you fucking nuts. And I can't wake up at 2 a.m., dude, and do a cold plunge and sun my nuts and fucking journal and do, I just can't fucking do all that at 4 a.m. But people have all the information, yet the outcomes are not better than they were 50 years ago. Mm-hmm. So there is a disconnect there for sure. Mm-hmm. And while we tell people is, and your philosophy is probably similar, I'm like, you can't listen to 10 different podcasts. Mm-hmm. It's impossible. You got to just pick the information you want to listen to and make the best choices that fit your life. Because if I sit here, and I love all the stuff that's out there, but I would feel paralyzed. Like I can never drink
There's too much
out of plastic. I can never go in the sun, or I need to go in the sun. Like for every example, whether there's randomized human control trials or not, there's books and podcasts and advocates for the other side. Mm-hmm. And so it's like, if that's me saying that, how does an average person decipher from all the shit that's out there? Yeah. You just tell them, like, look for the best ones, resources you can find, and just stick with those.
Yeah, I think it goes back to, like, what do you feel like your body needs? But that's where, where I feel like social media just hurts us is you see one thing and you think I need to be doing this, but really it's not fitting into what you need. And yeah, it's
tough, dude.
Yeah, it's hard
because when I talk to you, like I take what you say, like I don't want to say it's the holy grail, but like I believe the things you say, like, and you're somebody I trust. And I have other medical people too. And there's other ones I hear and I'm like, I'll listen to it. I'm like, but I also know everyone's a normal person. And I think sometimes in the medical world, whether it's PTs, OTs, physicians, surgeons, at least maybe not this generation, but like my parents, my grandparents, well, my doctor said this. I'm like, your doctor is a normal fucking person. And they argue with their husband or wife and they're in debt too. And they're stressed the fuck out.
They're not perfect.
And some days, dude, they just mail it in. I hate to say that,
Yeah.
but dude, I'm here. We work with enough of them. Like I'm tired some days, and I do the best I can on those days. But and here's the difference. Like for my profession, I still do work with humans here a couple days a week. I love it. If I was on the internet only, I would get fucking weird. Even though I'm not, super social by nature, there's something that keeps me normal about it. With that said, after 12, I'm a bag of shit. Straight up. Like I get up at 4, I'm here by 5. I'm good for like 5 or 6 hours with people. After that, I'm a garbage can. So like and I don't work with people after noon. And I know that about myself. So I know if I'm seeing you at 2, I would be giving you the shittiest version of Jeremy possible. The difference is like your doctor doesn't have a fucking choice. So whether he's having a bad day, shitty day, good day, he's seeing you at 3:00 on a Friday, dude, it might not be the best version of him. And I think like at least and again, I'm not saying your doctor's doing that, but just have an understanding of take the advice with a grain of salt. And it's okay to get multiple opinions on things.
Yeah.
I would almost urge people to do. So I guess if I bring it back to like PT, what's the worst part about physical therapy? I mean, from the outside, if I looked at it, the amount of shit you guys have to know for what the average person gets paid is fucking crazy. Because it's a lot, dude. Like you guys have to know so much. And for people listening, if they wanted, I guess I'll let you say that first, then I'll ask the next question. Like, what's the worst part about it overall?
I think if you just kind of put people in that bucket and you do the same exact thing with everybody. I've seen PTs like my dad went through PT a while ago. He had a rotator cuff repair, and I went to one of his appointments with him.
Do they know who you are?
I let them know I was coming, so that's why I was really shocked. But I walked in, and this kid hands him a piece of paper and says, "Go do these exercises."
Not a physical therapist.
No.
Okay.
A tech.
Yeah.
Gives him a piece of paper and says, "Go do these exercises on this table." Granted, my dad had Alzheimer's. I'm like, you think a 75-year-old male with Alzheimer's is going to understand and know how to do these exercises?
No.
And so then the PT comes over. He spends 5 minutes with my dad and then comes to talk to me. And I was like, no wonder he's not going to be compliant. It's just there are still some out there that even like physicians that still crank them in, crank them out, and you just can't provide good care. And, sometimes you can. Like sometimes you're just a badass PT and you can make the person know that like you are paying attention to them and you're giving them the best care possible, because it has to be individualized. When people just hand out pieces of paper and say, "Go do these exercises," yeah, you could go do that on YouTube and do just as well.
Yeah.
And that's what gives our profession a bad rep, is things like that. We are movement specialists. Like that's what we went to school for 3 years for, is to learn movement and how to make people more functional and efficient, but also consider the medical side of things too. And I think that's what people don't understand, is the amount of medical education that we have had. So I think that's the worst part, I guess, about is just the perception of that people have of us, and sometimes for good reason, because of experiences like that where you just see the basics and yeah. But with where insurance companies are going with the reimbursement, it's like we almost have to do that, just like physicians, where you have to see more people because you're just trying to keep your own doors open.
So is that like we would call that like a PT mill, where it's like you're just fucking churning them out. And like that guy, for example, he's got to see, that's multiple people like per hour then.
Oh yeah.
Because he's doing essentially it's the dentist model. You have 6 patients in here. Like when I go to the dentist now, I go to the same building. I couldn't tell you who the fucking person is, which is, I could give a shit right now. I'd like it to be the same person, but it's like Dr. K works this day, Dr. R works this day, and he sees me for all, he does taps around my mouth, which seems like it's fucking nonsense. Yeah. And that's like, it seems like, what are you doing? Like, it'd be like me looking at like, oh, your knees look fine. And then he's like, oh, Jeremy's good. And it seems to work out, but I don't have a problem. Like, where you're going to physical therapy because you have an issue that needs to be, and for most people who don't understand, like if you have an ACL repair or Achilles or something, which I think, or quad tendon, like some of these what I would consider major ones, if you don't do the PT, you're fucked, dude. Like you may never get back to what it was anyways, depending on age and you know what your kind of peak was. But to not do PT, you're in for a lifetime of basically dysfunction, essentially. And I guess for people who are listening, what do they do if that's a kind of a place like they have to go to, or they end up at, or their parent ends up at?
Yeah.
Can you look for another place?
Yeah, absolutely. I think Phoenix especially, but I think this is a nationwide issue, is, you know, a lot of groups are getting bought out by bigger groups and bigger hospital groups and that type of thing. And so it's almost like patients are getting forced to go to a certain place. And we've had patients before say, well, you know, I want to go to Spooner. Well, no, you need to go to this person in our office here. And they make it feel like the patient feel like, no, I don't have an option anymore, basically. And so people need to know, like, you are advocates of yourself. Like, you can go where you want to go. And I've heard it, like, you know, Spooner's probably known as a patient mill at times too. And that's really not what we are about. And it's just, you know, perception out there. But there are really good PTs out there and good ways of doing care. And so you just have to know that that is available to you and look for that. And, you know, we're all trying to do the best we can. You know, we want to provide to people that have insurance because that's still a population that needs it. So how can we do that in the best possible way and give the best possible care?
And is that why a lot of times they will say that is because their insurance, or they just want them to work? I guess it's like a referral network, right? Like, hey, we got our PT in-house. You go to our PT guy. This is what you do, even though you can go to multiple, or it's because their insurance only covers whatever. But you could, I guess what I'm saying is...
A lot of times now the bigger groups are kind of forcing their physicians to tell their patients where they need to go. Like, they have to stay in-house.
Because, like, we've had people refer you who have PTs in-house, but you're better than them. So that's like how we would find
mine's
you.
a little bit different just because of the specialty, but in just general orthopedics, you see that more and more now.
Because that's what I mean. Like, how do you... There is no gauge, right? Like, that's the hard part where... The world is so... Like, the PTs we've met are either through direct referrals from other physicians that we believe in, or we've met them through, like, social. And then we have to decipher, like, are they good or not? You know, and if you have a monster social media following, that does not mean you're good at fucking anything. I'd be the first person to tell you guys that. But sometimes it does correlate because they're able to do all the pieces together. So when someone's looking for one, like, how the hell would you even know? Because again, and I say this because the language we use here with coaching is so dumbed down, because it has to be. Like, I'm not going to walk in tomorrow and be like, okay, guys, we're going to retract your scapula and it'll just be fucking blank faces. I'm like, just pull your shoulder blades back. Like, that's how we talk. We don't say pronate, supinate. We say palms up. We say palms down because that's the general pop. And I bring that up because how does a normal person even know what to, like, look for? It's
I know
just
some people don't know any better, and so they'll go to a place and receive terrible care, and they think that's just how it's supposed to be, unfortunately. So I think knowing that if you're not happy, again, you have to be advocates for yourself. If something doesn't seem right, if it's not fitting your needs, like, there are other people out there. And so when you go into a place, are they listening to you as a person? Are they considering all factors? Are they talking to you? Are they getting your full story? Or are they just assuming you're here for an ACL injury or an Achilles tendon or plantar fasciitis, and they're going to give you the exact same exercises as they just did to the person an hour before you? So I think that's where you're going to find the difference between who's good, who's not, is who's willing to listen to you as a person. And if you don't feel like that's the case, the first place you go, just know there are a lot of other options out there.
And I would say it to anybody, like, worst case is you just go to another place, and even if they suck, you've given it, you've tried two places. But I would say just continue to keep searching out until you get the outcomes you want. Because I'm a fan of outcomes.
Yeah,
and I think
absolutely.
That's probably the worst part about PT, I would say, other than you guys, when you start off, you get paid $4 and then you work your way up and do whatever. But going in somewhere, getting a sheet of paper and sitting in a corner, which I do here more often than not. And I know it sucks because I don't think anybody wants to do that. No. But like you said, to be profitable, the business model is becoming that, which is, it's shit. It's just, you can't help people in that small window. Yeah. I mean, some maybe.
Yeah. And you can, I think, if you're proactive and, trying to think of best solutions and that type of thing. We've figured out a way to do it where we can still provide good care. And
if you have someone it's like my shoulder, all right, I've never had it, but if it was issue, I'm going to read everything. I'm going to do all the shit. I go, but again, I work here. This is what I do for my life. So I'm going to give a fuck. Where my dad, who's 66, does he even show up? Maybe. And if he does, if you don't babysit him through it, and he has no understanding of movement or body awareness for this, like it's that patient needs 10x the time that I would need. And I guess a good person would know that. Because like you at your peak.
And they'll be able to like show that value on day one.
Yeah.
You should be able to like hook that person in and show them that you care and you're going to provide them the right care and service.
Yeah. I guess what I say, like the way we phrase it is not as professional, but I'm like, they give a shit. Or at least they act like they give a shit. And they're listening to you.
Yeah.
Where like at your peak, I mean, your stuff is special, obviously, but you're only seeing 8 or 9 people a day versus like, what's the worst case scenario? Like PT, like what does the worst guy see in a day? 20 people?
Depends. It depends on the amount of hours, but I would say at our facilities in a 8-hour day, you're seeing ideally 12 to 14 a day. Some can see more than that and still provide very good care though. And some can see less than that and
Provide shit care.
Yeah, exactly.
Yeah.
So, there's some companies out there that will see 20, 30 people a day. And
dude, how tired do you have to be though? Like as the technician, right? Like you're the doctor who's like, you have to be exhausted, don't you?
Oh yeah.
Just to keep that straight would be, because I always give the example of, again, I go back to general medicine. If that guy's seeing 100 different people a week, I have like the people on the app, there's no way I could know them because the numbers are too big. But the loud ones I know for sure. Typically squeaky wheel gets the grease. But here we have a couple hundred members. We know them. We know their kids. We know where they work. I go, but they come 3, 4, 5 times a week, every week for a decade. So it's way easier.
Yeah.
Where a general doctor sees 100 different people a week. How the hell would you know if you're a PT guy and you only see the person once or twice a week, excuse me, and you saw 100 people that week, even looking at a chart, it seems like it would be so hard to keep track of everybody. Like you got to really give a shit to do that.
And there are some people that can do that and do a wonderful job. And then there's some out there that just can't.
But because the model, they kind of have to do it, even if they're not talented enough to do it.
Sometimes.
Yeah.
I mean, I would say, just speaking for our company, our expectation is 60 a week, which is very doable. And yeah, you're tired. I mean, you're with people all the time, but you can still provide very good care.
Yeah.
And still be successful.
But you're going
to business,
and you're going to see that person probably the next week and the next week and the next week.
Which is part of why I got into PT, because I wanted that continued relationship with someone.
That, at least that part of it like makes sense to me. I guess if you're a kid, I guess I'll ask you this, and I ask everybody, like if you had to do it, if you had to go through and do school over again, would you do it the same way or different?
We've been talking a lot about this as a company and just in our profession overall. It's like, I love PT. Like I love what I do. There are frustrations every single day of, could I have gone to be a PA for less schooling and make twice as much money? Sure. But would I be as happy as what I'm doing? I don't know. So at the end of the day, like, yes, it's easy to see the grass is greener over here. But when I look back, like I truly think this was what I was meant to do. So I don't know if I would change that. No,
you're very good at it. But yeah, if you're going to say in your guys' world, from an economical standpoint, what you really do is you be a PA, and then you do all cosmetic shit, fucking Botox, those are the people who crush.
Oh yeah,
because you do less school, but you get to give out all the fucking drugs, and it will sell forever. I hate to say that, but that's anybody listening, like that's the money.
Sure.
That's the money route. Because what you guys do, and I think even like OT, like occupational therapy, seems to me like way fucking harder. Like just from an emotional standpoint of doing that, and like not probably rewarding for sure, but dude, the amount of school you go through and get paid $4, and you have to like know your shit and be on top of it. That seems exhausting to me. That's why I always ask, because like like I love fitness, and this is a miracle any of this ever worked out. But yeah, I love it, but like in the same time frame too, like it's so different now.
Yeah.
First when we started, that's why I always ask the question, like if you had to go through and do it again today, like in 2024, 25, and you come into the world today as it is, like if I had to start over knowing what I know, like how hard it is, but like I got to rebuild all this shit again, and I got to start over from scratch. Like it's way tougher, dude. Than getting like, not that it's easy now, but it's easier in year 15 solo than it was at the beginning.
Yeah.
So I'll ask these questions, and I'll try to get you out of here in the next 30-ish minutes. Is that cool?
Okay.
You cool, Sean? Sean's good. The importance of like a consistent like mobility routine, just in general for people. Like, yes?
Absolutely.
Is there any, do you, like what we prescribe, and maybe yours is similar, we just say like whatever the minimum like effective dose is that they can commit to, like a day.
Yeah.
For most people. And again, I might spend an hour a day, but again, I'm not normal. I have the time and I really give a shit. Where for some people, if it's just 5 minutes, but I feel like it's the one thing that people do skimp on. Like we always compare it to like pre-workout is always going to outsell probiotics just for the fact if you can take it, there's beta alanine in it. Your face feels like you just snorted a pile of cocaine. And you know what I'm saying? Like you're going fucking like, it's once like when they used to make like the old Jack 3D, it's like literally like one molecule away from taking methamphetamine. So it would fucking work, dude. And I get it because you feel it. In the same way where we have a hard time, even in the only thing, again, I don't, probably like the way you feel about it. Whatever people take from your therapy is what they take from it. You have what you want them to take from it, but we always say take what you want and leave the rest. And so when we're here, we'll build in like a couch stretch and we'll show all the variations because most people would really struggle to be, shin completely vertical, heel to butt, all that good stuff. We'll have people who could practice that for 1,000 years who would never fucking ever get there. They'll skip it completely and they're laying here doing bicycle crunches. Now, in my head, I'm like, you're a fucking dummy, but it's their workout so they can do what they want. Is that kind of like, I don't know, what do you say with people? Like you give them the prescription and there's people who do it, there's people who don't. Like is there a frustration there where you're like, you guys aren't even doing the bare minimum we're asking?
Yeah, it is. It is frustrating at times, but then when people come in and they're like, why am I not better yet? And I ask them, well, did you do this, this, and this? No. And I say, well, I'm trying to give you some of the resources, information, education on, how to get better. But if you're not putting in the work too, you only see me 1 to 2 hours a week. I can't do that much in that time period. So like you have to put in the work too. But what I've learned, especially with working with new moms where you've got 5 million things on your brain at all times and you've got kids that need your constant attention. And then if you work too on top of it, it's like, I always try and like figure out what's going to be the most realistic for them. So if it's mobility or whether it's strength training or whatever, it's like, how is it going to fit into their day? And so I think, whether you start small and work your way up, it's just, again, it goes back to that individualized approach is like, if it's 5 minutes, if that's going to make someone do it, great. And then maybe if they at least start it, then they'll work their way up too. So, just kind of, again, going back to that education of the why and linking it all together. But then, what's going to be most realistic for them? For you, it may be an hour. For someone else, it may be 5 minutes. For another person, it may be what stretches can they do at their desk while they're on their computer all day. And for a new mom, it may be like when you're doing the laundry or picking up the kids' toys, like that's how you're going to get your strength in that day kind of thing. So it's just, to me, it's like what's most realistic. I could give someone a home exercise program and say, do this twice a day, every day for 10 minutes each. And I know that they're not going to do it whatsoever. So I kind of read the people and figure out like, okay, what can I give them that they are more likely to do? So, in the pelvic floor world, I know we talked about mobility and I can go back to that, but like, I'm never going to tell someone you can't drink coffee anymore because it's going to make you go pee more often. If someone's drinking 3 cups a day, I may back it down to 1 cup a day.
For sure.
Like you have to kind of meet them where they're at. Because if you go to one extreme, they're definitely not going to do it.
It's too daunting.
Yeah.
They don't look at it in pieces. They're like, well, and again, for most people, the all or nothing approach probably, for some, it does.
Yeah.
Like if you told me like, hey man, you can play basketball LeBron plays right now, and you guys are the same age, if you eat dog shit every day, I would eat fucking dog shit to do it. You know what I mean? I go, but the juice is worth the squeeze for me.
Yeah. Yeah.
But if you told somebody, hey, this will help a little bit if you do 45 minutes of just mobility work a day, there's no way they're going to do it.
I think we're kind of in that instant gratification stage too, and like you said with pre-workout, you feel it right away, so you're more apt to take it. So if you can give someone 2 stretches that they're going to feel awesome with afterwards, it's better than an hour of stretching that they're like, well, I don't really feel much different. So it's kind of like, what can you give them that's going to instantly gratify them as well?
Well, and we created a program called microdosing mobility, just like you would mushrooms. You do it with mobility work, and it's 5-minute blocks a day, and it's 32 days. They go through it, and that's all we ask is, again, and then as you go through the program, spend the time in the areas you have to spend the time on. And I'm not saying you don't have to do shoulder mobility, but if you don't have major issues there, you probably don't have to give it as much love. But it's tough because they want, like how fitness works is this. You get on the assault bike for a minute and you crush it. It can be the worst minute of your life for sure. It's all 4 limbs. Your heart rate is up. You're sweating. It sucks. Everyone hates it. It's easy to sell that feeling. To me, like rehab stuff and mobility work is almost like what you don't feel. You know what I'm saying? Like you take a prebiotic, or excuse me, like a probiotic, prebiotics, even both, and people are like, well, I don't feel anything. I go, yeah, but it's you not having diarrhea. It's you not being constipated. It's you having better gut health and better brain function because they do communicate. And that's the hard thing to give to people because there is not this, you're not jacked from it, but you're not feeling like shit. And if you can regain the function you had prior, like to me, it'd be worth everything. But you don't have to sell me on it.
Yeah.
And for other people, it's a tougher sell.
Yeah, especially when there's not enough time in the day and you've got 20 minutes and you want to get in the most, effective thing you can. That's not usually mobility or stretching that people think of.
No, and it's because if you take if it was even me, like obviously I have the luxury of being here all day, but in terms of like, what do I do at home? Like if I was to get on the floor at my house, we have a 15-year-old dog and an 11-month-old puppy. There's fucking zero mobility going on. It's dog hair. It's whatever, you know what I mean? Like, and imagine you have then 2 kids running around. It's like, you have to almost like lock yourself into space to do it. If that's and that's the advice we used to give the people. I'm like, no, if you can be at your desk, wherever you can get it, any time of day, that works. Do you have like a personal, like a movement prep that you do before workouts? Like, do you dedicate a certain time or do you just like, because you're in
like I say, PTs, medical professions are the worst patients ever.
Do you do nothing?
I mean, no, I do stuff. So no.
Like if you're going to go play, like, because again,
I'm much more dynamic mobility to start, kind of that more static mobility to finish kind of thing.
Yeah.
But I'm 100% guilty of it. I have 2 young kids and a full-time job, and I'm come up with excuses galore of why I can't fit in a workout every day. And I finally just have this realization, like, stop making excuses. You can do 10 minutes and you can do. So, I mean, I'm my own worst enemy.
Like I'll frame it this way. Like if you were to go play tennis, and I'm not saying this in a negative way, you're like a shell of what you used to be, because I played basketball in college as well. And
it's a shell, that's for sure.
I can think I'm the same guy. And then like Heather will like watch me and she's like, yeah, you're not the same at all. Like, and the example I give is like, and this is me flexing, I can still dunk a basketball off concrete easily, in parentheses, at 41 years old. The amount of the routine I have to go through to do that is like a half an hour plus. And then me talking to my wife who's filming saying, this might be the last time that this happens because something bad might happen. And I'm like generally like nervous for myself. Yeah. And so, and I think about when I'm, prime me's probably 22 or 23, where I would go in, drop my backpack, maybe take a fucking 10 jump shots and just like through the roof and wouldn't think twice about it. So when you go do stuff like that, do you have like more out of like fear of like hurting yourself?
Yeah.
Because like, I mean, if I think about tennis, right? Like, and I can't play for shit, it is dynamic in how you move and start stop. And like I would imagine like ACL, MCL, LCL, PCL, like Achilles, like
Achilles. Like nowadays my fear would go to Achilles or
So like when you play
shoulder.
If you do play anymore, do you put like a governor on yourself? Like here's my example. So we played in this stupid like homemade basketball tournament with these 40 dudes for 25 years. And you can imagine the amount of deconditioned everyone would be versus the three of us that would be fit. And my other buddy, Dave, which Sean knows real well, like we both live here. We travel back home to play. And every year we're like, okay, we're just going to like play like we're old. But within 10 minutes, dude, it's like you think you're you're like, that guy has been dead for fucking 20 years, but you think that. And so and then we'd be done. I'm like, I'd have a calf tear.
Yeah.
I'd pull my fucking hamstring, or like you sprain an ankle and now it's like, it's a balloon. It doesn't come back. Do you have any of that when you go? Like,
yeah. And I haven't played tennis in a while, but a couple weeks ago we were in Colorado and my family was like, let's go play pickleball. And I've been wanting to try it forever because.
Oh, yeah.
And so I was like, oh, I got this. I played competitive tennis and all this. This will be easy. And it's not even as much movement as tennis, but it's kind of eye opening that you're like, okay, I'm tired after 45 minutes and, you know, my shoulder hurts and my neck's tight and that type of thing. And you just think you're invincible.
And we do see, and you say pickleball, our friends just built one in their backyard. I've played it like a birthday party. The rules were a little
they're a little wonky,
complex for me. But the amount of people who come in here who are older,
oh gosh, it's
and they play for 4 hours,
yeah,
and they're like, "Oh, my elbow hurts." I'm like, "Well, you're death gripping a fucking paddle, dude, for 4 hours, 4 times a week. Like, you're gonna have issues." And I do think that's where having some kind of movement prep routine would be ideal before even the basic stuff. Just because that's what I do worry for them, and not that they're not explosive movements, but if you plant, and when you look at like deceleration,
twisting,
it's kind of gnarly.
We call them, I don't know Gary Gray, who does physical therapy, but he talks about his transformational zones of those areas or movements that you're most likely to become injured in. And that's what you want to train. And that's what you want to stretch and mobility and prep your body for, because that's where you're more likely to get injured. And so that's kind of what we'll tailor some exercises to, or mobility. And I always try and think of like, what's the least time consuming, but will target the most areas of the body. And so getting your body moving in, 3 planes of motion, what's going to be the quickest thing you can give someone to do that at least, you're covering kind of all your bases. Because
the average person they live in one plane most of the day.
Well, that's what we all think, right?
You know what I mean? Like, I guess I was saying there's no dynamic movement in the average person's day. When you look at, like, when I pull average numbers, 3,000 steps a day, give or take, is about the number. Most of it's sitting. People don't walk backwards. People don't move laterally at all. And they go from that to pickleball, being competitive, trying to beat their neighbor or their brother. And then it's like, that's when, and it can go sideways anyways. But I guess that's the biggest thing, is going from essentially you're in like a coffin that you made all day and you got stuck in it. And now we're going to go out and just let it rip on a pickleball court.
Yeah.
And I guess that's what I'm asking is like the stages of life and I believe mobility and strength training and all of these should be a part of everybody's life in some way, shape, or form in every age bracket. But from 20 to 30 to 40 to 50, there is a difference. And I guess I just look at it as like there's a price to be paid before and after you work out or play pickleball or tennis or basketball or whatever. And that's what it is. And you kind of just have to commit your mind to, if I'm going to keep doing these activities, like mobility for people is hard, right? And hard things lets you do hard things. And even though you love tennis or pickleball, whatever, I go, you have to train to have the ability to keep doing that. Otherwise, things can go sideways really quick. Like in your training, like for you, like do you have like a minimum, like, hey, I strength train on these days, or I walk on these days, or do you have anything that like the bare minimum, or you're just like some weeks you just say I'm too busy, fuck it, and do nothing?
I mean, I am getting back into the like routine part of it all. So right now I'm at a point where just do something, like just do something physical.
Because can I ask how old are you?
38.
Yeah, you're in the we call it like the 40. Like when you're in the 40s, it's you graduate from like thinking you have to do this thing to what is just, I guess here's my example. Like I'm here and I love fitness. I'm still half naked on most of our shit all the time. So there is that external motivator to not look like a fucking trash bag. And it's not indicative. If I know anything, I go, but that's the brand we built. I put my name on the door. I'm a fucking dummy. So I got to live with it. I go, but there's days where I don't want to do this shit. And I'm not 22. And so my stuff will be tight and it will be sore. And I'm like, just set the clock, dude, and do farmer's carries and push
Yeah.
a sled. And I'm a grinder, so I don't mind that because it's brainless. I can put on Batman and I can just enjoy my 20 minutes. And you have something similar, I imagine. Like just, do you do it at the facility or do you go somewhere separate? Because you guys have a gym there, yeah.
Yeah, yeah. Yeah, it's a little bit of that to like my biggest go-to is walking. I mean, I have a 1-year-old, so I've just kind of this last year has been getting my body back and just back to me again and hormones all over the place. And so, yeah, it's been a struggle. Like second kid, just really trying to get back into my normal life and who I used to be. And
did you think it would be easier or no?
yeah, just knowing what I know.
Yeah.
And
you're like, fuck it. It'll be not easy, but easier.
Yeah. Yeah.
And
it's like I know better, but
yeah.
And my brain plays weird tricks on me, and I know I'll feel 10 times better if I just go do something for 20 minutes even. But, that's just that's a side note of some of the mental struggles I deal with work to kids to
for sure
house to all sorts of things.
Well, and I guess we ruck a lot. It's just it's walking with a heavy pack for people who haven't listened to the 80 episodes that we've broken it down. But people really overestimate walking. They don't look at it as exercise or a source of activity. But for a lot of people, if you just, in general, whatever your goal may be, if you got decent sleep or tried to, and ate decent and walked around, like that for a lot of people solves a lot of problems. As weird as that sounds. And sometimes for people listening, like that's all right, dude. If you just fucking walked for the day, like that's sometimes good enough, especially if you're older and you got shit going on. And that's me saying that because there's days where I had a shit fucking year, you know it, where I would come in here and the last thing I needed to do was like heavy deadlifts and split squats after the shittiest fucking day I'm having. Like there's more stress I'm getting from that workout than it's taking away from me. And I think that's a big thing for people to listen to. Like, so if it's just walking, dude, like you'll be okay.
And sometimes better for you too. If your body or your mind is, not in the best place. There were times where I was like, I didn't sleep because both my kids are sick and they're up all night and I'm not feeling well. Like that was not a good day for me to go lift a bunch of weights. So
and bury yourself even further.
Yeah. Like wear myself down even more. My nutrition's all over the place because at times you're just trying to eat in general. So it was learning to kind of have some grace on myself as well. And now I'm getting past that point. So it's like, all right, now you really need to shape up a little bit.
Well, it's different too. Cause like you've lived through it as an athlete because we've had so many on here. And I know the feeling where it's like you were this person for 22, 23 years.
Yeah.
And for me, I was that person. And then I go do like my GA and strength and conditioning. So you're kind of in the world, but you're not. And then I move here and I'm like, fitness just wasn't what it is today. Like there wasn't as many opportunities, at least for me. Or unless you want to go the strength and conditioning route, but it's like a traveling carnival. You got to go from school to school. You get paid shit money. Yeah. And so I went from being the man, having all the juice, to sitting at fucking Enterprise Rent-A-Car at a job interview, and I don't want to fucking be there, and the lady thinks I suck and doesn't want to hire me, and I'm like, fuck, dude, this is my life. And when you say like who I used to be, I was just this 6 months ago, and now I'm not. Yeah. But in terms of like your skills, they slowly diminish over time. Where I'm assuming like when you have a kid, it's like almost instantaneous, right? Like you go from like this life to
that was hard after the first kid. It's like, who am I now? You kind of have to find yourself as a new person, and I'm still trying to figure that one out. So
and still work and do your stuff because you put so much time into it too.
Yeah.
I'm gonna ask you this because I have to before we go. Your thoughts on just foam rolling, tissue work in general for people? Because again, I've talked to a lot of people. It makes me feel better. Yeah. I know we meet a bunch of people who are like, foam rolling is horse shit and this and this, this. I'm like, I guess if you hate it, dude, don't do it. But if it makes you feel better, do it. Do you have thoughts on it?
Yeah, I love foam rolling. But, I think it's how you're doing it and why are you doing it.
For sure.
And so that's kind of what I look at. If someone's got a tight muscle and all they do is roll over the foam roll 20 minutes a day and it's still not getting any better, like, is that the best thing for you kind of thing? I love to use it for postural movement and mobility. So I think it's just kind of,
What's the goal?
yeah.
Like when we look at it, like what can articulate a real change, like in the tissue?
Yeah.
And I don't use like, for me, it's not a lot of just get on like the Perform Better soft composite rollers. Like it really doesn't do shit for me at this point. I go, but when I can actually dig in and get that cross tissue, cross fibers, like in me, it feels better. Like I can get things loose, and it's alleviated so many things that I think would have either nagged at me
Yeah,
or
I think if you stay on top of it and you're proactive instead of reactive, it's when I see people being reactive and they're working on a, tight hip flexor or quad, and they constantly have to roll and roll and roll, but it's not making any changes. Like that's probably not the best thing for you. Like you need to figure out what's causing this persistent tightness more than anything. But in terms of just using it like post workout, just to make sure, your tissue doesn't bunch up and get too tight and you're keeping your, efficient muscle length, and then yeah, absolutely.
and like along the same lines, like if you feel good doing it, like
If it gets you doing something, great.
yeah, like the percussion stuff. Like if it's like, hey, it's a Theragun or I'm doing Normatec stuff, like whatever it may be, whatever your thing is. If you feel good, do it. If not,
Yeah,
do
if you're
something
still
different.
noticing that there's issues or something's not getting better, then ask more questions.
Like for people like where we've gone in and done like gua sha or Graston or something, where you get and it's almost like ART with it, right? Like, so it's manual therapy. I've had times where, again, I'm a meathead, so you lift so heavy, and now it's like I can't turn the steering wheel on my car because I can't move my fucking arm. And I'll try all the things, and then after 3 days of being a dummy, I'll go in, and it's like I can get that released sometimes, and I'll walk out of a session of doing a combo of tissue work, manual therapy, and now I can do everything, or I'm 99% better.
Yeah.
And I think a lot of people kind of just think like, well, this is, I guess what I'm saying is pain is normal and it's part of life, but having like debilitating chronic pain is not.
Yeah.
And if you can't fix it, going somewhere else. And those other questions I was going to ask you too, in terms of, because you do dry needling versus like acupuncture. For people who are listening, if you want to break down like
The differences?
Yeah, the differences and which one's appropriate for what circumstance and why. I know it's a loaded question. But.
Yeah, I mean, first and foremost, PTs are not trying to step on top of acupuncture. It's a totally different thought process of why we use it and what we use it for. I'm not going to pretend to know I know all the reasons why you do acupuncture. It's based on Eastern medicine, so you're making an effect on, meridians
is how they
points,
talk.
lines, and that type of thing. So I have done acupuncture for various things in my life, and yeah, I think it helped, but there's a time and place for dry needling. So in my mind, dry needling is for dysfunctional tissue, neuromuscular junction where you need to make a physical change in that tissue right away. So if you look at it from 3 different components, if you were to look at a muscle on an EMG study, so you've got electrical activity, you've got, so on an EMG, if you were to look at a muscle, you would see at rest, there should be no noise. It should be quiet. But a dysfunctional muscle, you will hear kind of that movement, background noise. So you need to make that kind of electrophysiological change on the muscle. It was originally developed for the trigger point pain. Yeah. So you find a point that reproduces your pain, and that's the point of the muscle that you're trying to target. Whereas in acupuncture...
give an example for these guys.
So if you think of patellofemoral pain, so it's not just always your patellar tendon, but if it's, tightness of your VMO, or your VMO is not
so your
firing.
Your knee hurts.
Yeah, exactly. Yeah. Your knee hurts. Sorry.
Yeah, I love it, dude. I know what you're saying. I go, but people are like,
I know.
What
I know.
is
Okay. You have knee pain. Yeah. You have knee pain when you go downstairs or you're hiking down a mountain or whatnot. So we tend to think like, oh, there's a tendon issue, or, something's wrong with my knee joint, my meniscus, whatever. Sometimes it's just that the quad muscles are either not firing properly, they've shut down for whatever reason, they're too tight. And so that's what you're trying to figure out. So sometimes if I'm getting someone with knee pain, I'll dry needle the VMO and like the quad muscles and try and make a change in that muscle and neuromuscular junction instantaneously, instantaneously to get rid of the pain, but also like make that muscle unit fire more effectively and efficiently to allow you to move properly to reduce your pain.
So almost like an electric shock. That's how I describe it. Like you feel it like
you're causing an active twitch of the muscle to basically release the muscle. So you're causing that maximal contraction to make a reaction and release the muscle so that you can then train it properly and allow it to, function and fire like it's supposed to. So chronic headaches. So if you've got like a tight upper trap muscle and you find a point where it's really tight, or maybe you push on a point and you're like, oh, that reproduces my pain in my head. That's the point that you want to needle, because you're going to make a physical change on that muscle tissue and then reduce your pain. I mean, you can get some instantaneous changes right away. Whereas acupuncture, if you've got headaches, you may be putting needles in your hands or your feet or your abdomen or wherever. So that's how it's different. And we're going a lot deeper. So we're going into the muscle belly itself to make those kind of fiber changes right away. Whereas acupuncture is a little bit more superficial. Again, you're working on the meridian points and the meridian lines. So those are kind of the major differences.
So if you're somebody who, like, for example, like you do have, like, which most people have tight traps, essentially. I guess not everybody, but pretty much every human that I meet. If you sit at a desk and if you stress, depending where you hold it, if you've been going to get massage and you're getting tissue work and it doesn't seem to fix it, like dry needling might be a route to try.
Yeah.
Honestly, like, it's crazy. Like, I'm so dumb. I never thought of that till like just now. I don't have that, but my wife complains about it all the time. And I'm like, God. And
that's a cool thing, is like you can see big changes right away.
Yeah.
And if you've been foam rolling your quads out for so long and it still feels really tight, or your hips or your traps or whatever, and it's just still not getting any better, then dry needling can help. But it's not the only thing to do. So you needle something and then you want to properly train it afterwards, or stretch it, or it's not just a one and done. That's the only thing you need to do kind of thing.
And that's where you guys will give a protocol post. But it is because when you do it, you do feel whatever the feeling may be. There is some, I don't want to say looser, it's not the correct term, but you're alleviating the problem like almost in real time. Like sometimes you can feel it be like, oh, yeah, now my hip is not as tight, or my neck is not as tight.
Yeah, you may have muscle soreness, but your movement is better. The reason you had pain in the first place can go away.
And like, and there's a bunch of different types of acupuncture. I've been through a handful, but I got a dude down the street I'll go to, super nice guy. And he has his own little routine. He goes through whatever, but really I just go there to like fall asleep.
Yeah.
To be honest, like, no, I don't check my phone. No one can fuck with me. And I do feel like, and it's weird because I fall asleep every time. I lay there, put my face in the thing, and it's just like, we just poked me up, dude. And sometimes it's in my neck. Sometimes it's in my hands, my feet. It's definitely it's passive, where dry needling is not a passive thing. You're trying to.
I don't want to speak to what acupuncturists do because that's their expertise. But I mean, I did it before too, and it was a great way to just go in and chill because I was not allowing myself to do that otherwise. But I mean, I did it for other reasons too, and it was definitely addressing that. But dry needling is very direct. It's very active.
Just to solve like almost, I don't want to say pinpoint, but like a direct problem. Like here's my example, I guess I'll give, and we'll get out of here. Like I've never, like, knock on wood, like been injured. But I had like L304, L405, L5S1, like bulge, and then a roofing at that. And literally I would never have known. I was sitting in this seat actually, and then it felt like the fucking Holy Spirit entered my body. Like, and I sat in, Monica sitting across from me, and I'm like, I don't know if I can stand up. Like, that's how sharp this spasm was, or whatever it was. Dude, that shit was so fucking tight, dude, for like months. And I'm trying to do all the things. Eventually you get the MRI, whatever. And I have my own opinions on MRIs because it's just a snapshot in time. It's not really who you are. You can believe it. Then I could talk about this medical shit all day. But I tried to, like a dummy, let me just not tell anybody and do my own shit, which to my, I guess in my defense, most of the time I can't fix the stupid things that I do. This was not one of those. So I went to like an acupuncture dude, very, very traditional. And like the dude's like, doing his like massage with the elbow like in your fucking spine, and I'm like, bro, this probably ain't the thing. But his was like hooked to like the electrodes, if that what you want to call it. It would help the tissue for me, like the erectors at QL get loose for sure, but it wasn't fixing the problem. Mine literally was going through a handful of people because my quads would get so tight, everything would become tight. I imagine psoas, everything in there. And I bought all the shit. Like, let me buy the hip hook. Let me buy, and I'm doing like it first, and I'm sure some of those things work. But when your front chain is so tight, pulls the pelvis forward for me. And then once my quads became loose, it's like it never happened.
Yeah.
But that did take a long time to get them loose. And that's just overtraining, doing too much computer work, you name it. And a lot of people don't know that, where acupuncture, it helped the muscle, I guess, get loose in a sense, but it didn't fix the issue I had going on. Where if you do, when I've had like dry needling done, if it's especially like soft tissue stuff, or even if it's nerve related, it was like, it's there. And I felt it by the time I walked out.
No matter what you're doing, whether it's acupuncture, dry needling, percussion therapy, tools, ASTEM, whatever, you're having a direct effect on the neural system, the nervous system. And so whatever clicks for that person, and it's going to connect with that neural system to calm the body down. That's why acupuncture works for a lot of people in certain regards. And, you know, the tools and the percussion guns and but for dry needling, I mean, you're making an impact on the neural system as well. You're just having much more of a direct impact to the muscle tissue itself. So for like the spine, what you were explaining there is like, I would not only want to do it to release the spasm muscle, but also it's almost like you're waking up your stabilizing muscles again, because when we have injury, those muscles shut down first. And so I will utilize dry needling a lot to kind of wake up the system again, to get the muscles firing that we need to prevent injury in the long run.
Well, and that's like, and I mentioned the imaging and the MRI stuff just for the fact of they're great for what they are, but I've sent them to friends of ours, but before I met you, and I'm like, hey, and we have multiple surgeons, and when I say chiropractor, I don't mean like crack you and set you off. They're more like
active release.
Yeah. Like Russ Teams is like, he's a neurologic guy. So it's very much brain, eye movement, everything. And he's very much a recovery dude. So I had him on the pod by the grace of God, like 2 weeks after this. I'm doing the fucking episode on kneeling because I can't fucking sit. And then between like him and Dr. G, I'll send him my stuff and I'm like, what does it look like? He's like, you look like a 40-year-old dude who's deadlifted 600 pounds 1,000 times. He goes, but it's just you today. And now that we can see this, we can work on that stuff. My point is, people get those images and then now they feel like they're
focused on that.
And they're like, well, I'm fucked now. And if you take that to in my opinion, I don't want to say the wrong person, but a certain type of doctor, you're on a different path now. So when you get people like that, you obviously approach it different, but you're often not the first person they went to.
Yeah.
So if you go to someone, I guess if I would have took that to someone who cuts and does whatever, I could be looking at like surgeries for something that literally I don't know, 2 years removed from that. And it feels like it never happened. And I can do all the same stuff I could do before. That's it.
Yep.
Yet if I got a surgery done, especially if you're talking spine stuff, whether you're talking about losing the movement in these areas. And we see that a lot here where I'll meet people who are like, well, and whether it's lumbar, C-spine, T-spine, you name it. And they're like, now they can't turn their fucking head or they can't do something. And I'm like, I don't know, but I'm like, I wish you would have done these 15 other less invasive things. Again, it takes longer.
Yeah. And I think you look at an image and it gives you one story and perhaps you get surgery based on that one image. And then I have people come to me and like, why is my pain not gone? I'm like, well, that wasn't the reason you were in pain in the first place. It's like, you have to figure out where the person's hurting, why the person's hurting first. And then if surgery is still necessary, then, if that's really their true pain driver, then surgery could be beneficial. But what I hate seeing is someone goes to get back surgery and they're like, well, why is my pain not gone? Well, back surgery is not meant to take away pain. It's meant to keep you from, not going numb down your legs and losing function altogether kind of thing. So is surgery affecting what you're truly feeling, or is surgery just going based on what the image shows? A lot of times pain is not what the image is showing.
Well, and for those, and you can correct me if I'm wrong, but I've been in rooms of savages at Reebok. Was with them for like a decade, and you would have someone like a Kelly Starrett or somebody be like, dude, if we looked at all of your knees and all of your spines and we imaged them, none of you are walking out of here looking perfect.
No.
Just off of what you do. And I don't think a normal person knows that. I think they think their stuff should look a certain way. And if it doesn't, it's almost like this panic goes off. It's like, well, you've had that spine for your whole life. Mm-hmm. You've had those knees and those ankles forever. And like a car, kind of, there is wear and tear that happens. And you just can't replace the brake pads. Like your knees are your knees.
Yeah.
And I guess that's something for anybody listening. Like if you do get a scan or an image, like it is who you are in time, but it's not the end all be all.
Yeah.
And again, I would go see, I guess I'll ask you this and I'll get you out of here. For people who are like living in pain, or whether it's your area of expertise or not, like the pelvic floor stuff for sure, like what's your advice to them?
Yeah, I've learned over the years, I think my first couple years, I would use the term, oh, I got to heal you. I got to get you better. And I learned like, I can't heal people. I can only be their guide. And especially with my pelvic floor patients, that's what I tell them. I'm like, I'm here to be your guide. If I can get you 80% better and give you a lot of tools to continue along that pathway, that's my ultimate goal. For any patient, whether I'm treating their knee, hip, shoulder, whatever, is like, I'm not here to be your healing person. Like that would be great. And if that was the case, I'd probably be a lot richer than I am now. No, but
you know, like there's doctors who like, they'll be like, and again, I'm not talking shit about you guys, but like, I'm a healer. I'm like, well, drugs don't heal you. People don't heal you. Your body heals it fucking self.
Exactly.
Dude. Like that's how it works.
So if we can give you the right tools to help you along your journey, that's ultimately the best thing for anybody is, you know, they're ultimately going to help themselves.
Like, do you think the average person who's out there, and again, I just think people who are younger, we do have more information. So like we're learning more stuff. And I think people are more skeptical now, maybe than ever before. But I feel like my grandma would have been like, well, my doctor's going to fix me. And I'm like, he can't fix you, bro. And I guess that's a question. Do you think there's people who still come in and think like, if when they come to you, you're going to cure them?
Yeah.
Like this, I would imagine I've never, knock on wood, had a major surgery for something I've fucked up. God willing, I get out of this unscathed. Because I've watched friends of mine, like, because we video everything now. We're dummies. I've watched friends, even Stacy Barber. I watched her tear her Achilles doing the fucking warp wall. And I'm like, I'm almost puked when I watched it. And I'm like, I hope that doesn't happen to me. But I imagine when you go in as a normal person who's not a fitness freak, you're thinking like this doctor's going to fix me with this surgery, and I'm going to be the same.
You have that hope.
Yeah.
Like you go in there with that hope, like this is going to be it. And it's hard for a lot of people when it's not it. Yeah. And, you know, I've seen, especially in the pelvic realm, of like hysterectomies because they think that's going to cure their problems, and it doesn't touch it at all. And so now you're left without your uterus. And
you went through this. Seems traumatic.
Yeah.
The whole thing.
Yeah.
And they come to you and they're like just looking for
some hope.
Yeah.
Yeah. So I think that's what is a big rewarding part of my job is like if I'm able to do that for someone who's been just kind of through it, you know, but I will kind of preface that of like, I'm here to give you as much information as possible and as many tools as possible, but, you know, and what's realistic too. Like, for some of my pelvic patients, it's like, you know, it may not be realistic for you to be completely pain-free all the time. But if I can get you pain-free a few times a week and you're still doing the things you love, but yeah, you're a little uncomfortable, like to me, that's a success. So I think people are looking to be heard, listened to, just given some glimmer of hope. And, but I think the more we're informed, the better it can be in a way. I mean, sometimes it's detrimental, but
yeah, if you go, well, don't go on Google.
Yeah, don't
go
to Dr. Google for sure.
But we all do it.
Oh yeah,
you do it too?
I do too. Sure.
Dude, I've gotten like, I said I wouldn't do it anymore, and then like, I lived the last year, and bro, do you know how much fucking shit I've learned about so many things that I never wanted to learn, and I'm like, this is not like. I don't know if it's good or bad. Like it's good in a sense if you can talk yourself out of shit. So if you can read your own blood work, which now I basically can, and I know all the things, and I'm like, okay, if this is high or this is low, this is why, because they play off each other, and I ate this way and I did this, and like, if you go to a doctor who thinks a certain way, he might tell you something. I would be like, well, fuck you, you're wrong. And because I know more than they do in that single arena, I go, but it works against you when you start to read, like, it's almost never good, I guess is what I'm saying. When you go on the internet and you Google all the things, rarely do you find the outcome is positive, right? Like,
Yeah, they're not going to tell you good things.
it's always the worst case shit. So I would say don't do that. And I would say if they can find someone like yourself who, because you are realistic with people, but you talk them through like, hey, here's all of the information you have, instead of like just, because I guess the worst thing it is when you go to a physician and it's like, here, take this, do this, you'll be better. And then if you're not like a person like me, you would just accept that, and you probably would feel like you're inconveniencing the doctor, or you feel like an asshole, or you're doing something wrong when what they gave you wasn't going to work anyway. So yeah, I guess find somebody who does all the things, which is tough to do. So I guess for someone out there, if they're like, they've been dealing with some like pelvic shit, pain shit, for, I mean, how long? More than a week? Should you go? I mean, how, 2 weeks, a month? Like, I think it's all different for everybody.
Depends on, what you're going through. And if you know something's off in your body, like, seek help.
Yeah.
And the good thing is nowadays.
Like, where do they start? If you're in fucking Slidell, Louisiana, like, you just get on Google and try to find somebody? Probably. Or go to your general doctor.
Yeah, go to your general. I mean, there is a website called pelvicrehab.com where you can type in your zip code or city and it'll pull up reputable people in your area.
That's cool.
Yeah. And that have gone through like specific training and that type of thing. So it's, easier to find people that way, I would say. And most insurances these days, it depends on the state. If it's a direct access state where you don't necessarily need a physician's referral to go see a PT. And I always say, even if you do, come in and see us, we'll figure it out on the back end. But just be advocates for yourself and, start somewhere. And if you start somewhere and it still doesn't seem right for yourself, like, keep asking questions.
And if people are in like the valley here, like you have like a network of people that you guys work with who do pelvic floor stuff, dudes and chicks.
There's actually not. Oh, like who see men and women?
Yeah. There's not a lot of dudes.
Yeah.
Right?
Yeah. No, there's not very many males treating that population.
Yeah. So if you're a dude, you got to see a chick. Get over it. Yeah. You know what I'm saying? Well, like women go to like all kind of dude doctors.
Yeah.
Which it is what it is.
At the end of the day, it's a very professional setting. It's a medical facility. Yeah. Like it's, it's your body. It's.
But like, the apprehension behind dudes, like even friends of mine where they'll be like, they're 40 and they don't even want to go in and like, or even 50. I don't want to do a colonoscopy. I don't want to like have my prostate checked. It's like, dude, it's not a fucking porn adventure. Yeah. Like they're doing a fucking task. And if it's a colonoscopy, you're out anyway. Yeah. You don't even know what happened. And the other shit takes all of like 2 fucking minutes. Yeah. Like, and it sucks, dude. Like none of that stuff. I don't think anybody like looks forward to going to the dentist or like, hey man, let me go to the proctologist or the urologist, like, or do pelvic floor PT. I go, but that information I think is useful to know. So if you do have something that's really fucked, you find out sooner. And if you don't, it's the peace of mind of like, okay, well now we can look to the other areas. But it's tough for people to take the first step. Yeah, for sure.
Sure.
Where can these guys, your social media stuff? Because I know you post like every day. I'm kidding. I'll share your stuff. I'll share all her info on the thing. You can harass her if you want to. Or if you have a referral network that these guys can go to, if you're in the valley here or wherever. But no, this is beneficial, dude. This is good stuff. I learned a lot. I appreciate it. Yeah. For you guys at home, if you, what do I got on the docket? Oh, 12-week transformation. Links in the bio here. If you guys want a free sample of AG1, hit me up. If you're an Apple Podcast, drop it a 5-star, leave a review. Don't be a lazy ass. Same thing on Spotify. We appreciate it. I'll put all of Carrie's stuff here in the show notes. If you got a specific question, I'll see if I can shoot it over to her or have you get a referral person in your area. And if you're in the valley here, super easy fit. We can get you guys hooked up there. So I appreciate it, dude. That's all
thank
good
you.
stuff.
Thank you for having me.
Thank you, Sean, as always. Until next time, you guys, eat well, train hard, be nice to people. And please, you guys, keep doing shit you love with people you enjoy because your life is too short not to. I'll talk to you soon. Peace.